Well, welcome everybody to our second virtual Food for Thought discussion. This whole month of September, we're going to be focusing on the emergency department and how important it is to the hospital, how safe we are, and what protocols we're taking. I'm joined by Dr. Jeff Pino. He's one of our emergency department physicians. You've probably seen
Hello,
him.
everybody.
Yeah, you've probably seen him around. If you've seen our virtual tour online, and he's done several interviews with TV stations recently. So he's here to talk about the emergency department, and I know that's been a big topic, especially during COVID. We've seen a drastic number of people avoid maybe the care they actually do need because they're possibly scared to come to the emergency department. But that shouldn't be the case. People should not delay care, should they?
Absolutely not. You are right that people have been delaying care in the last few months out of fear that they may get sick, and I think that is a rational fear to have. However, what I could say is that Medical Center has taken the utmost precautions to try to make sure that if you come to the ER for a medical problem, we are going to keep you safe from contracting COVID-19.
Now, talk a little bit about maybe some of the safety protocols that we are taking here to make sure people are safe. It might be a little different experience than if you had come to the emergency department, say, this time last year.
Yeah, absolutely. Well, first and foremost, you are greeted at the door. As soon as you come to the ER triage area, you're greeted at the door by a greeter. Usually it's an LVN or an RN who's there to take your temperature and find out what's bothering you during your visit. What we're then trying to do is we're trying to expedite getting the patients back to a room more quickly. So rather than staying in the waiting room for an hour or 2 hours like people have done in the past, now what we try to do is bypass the waiting room and get you right back to your own private room, get you situated, get you comfortable, make sure that the doors are closed and you're safe from any sort of contamination or airflow, that is, and then the nurses come to you and the doctors come to you. And that's a big difference in what traditionally has been experienced when people come to the ER.
Yeah, normally people think about the long waits and sitting in the waiting room with other sick people, but MCH has really taken a forefront on this, and you'll never, that's why they have the screeners and the vitals up front to determine whether you are actually a COVID PUI or a non-PUI, and you're immediately separated into separate areas. And then we also have two separate sides to the emergency department as well. Talk a little bit about the two different sides as well.
Sure. Well, hopefully everyone can get a chance to see the video that we did with the tour, because I think that really adds a lot to the experience in helping you prepare for a visit. But we do have two sides. We have the A side, which is where our more seriously ill patients end up, the ones who need a little more attention. And then we have our B side, which would be where more of the cuts and sprains and bruises and the minor stuff may get seen. Both places, meaning the A side and the B side, are staffed with ER trained doctors, which I'm proud to say we're the only hospital in the basin who does that. And so whether you're there for a sprained ankle or you're there for a heart attack, you're going to see the same quality doctor take care of you. And on both sides, again, as I mentioned earlier, all the rooms are private now. All the rooms are what we call negative airflow, which means the air is not recirculated. Your own air is your own air in the room. You don't have to worry about catching any contaminated air from another patient who might have a respiratory illness like COVID next door. And I think that we also have a small little fast track area for patients who really have a minor issue. Say they need a medication refill, or say they need their stitches removed. We have providers there that can get you in and out the door in 10 minutes.
We also have some trauma rooms as well, and that plays a big part, especially with the high traffic around here with the oil field. Talk a little bit about those trauma bays there as well.
Sure. Well, we've got two trauma bays that are dedicated only for trauma patients on our A side, again, our more critical care side. And even though recently our level 2 status dropped down to level 3, we still function as a level 2 trauma center, which means that we have trauma surgeons in-house 24/7, 365 days a year, and you also have board certified ER doctors like myself around the clock in the ER. We also have the largest call schedule of specialists in the basin. There is not one specialty that we do not have at Medical Center, and which is why all the hospitals in the area, including our own hospitals here in the basin, refer everything to us because we have everything that you need to be taken care of.
And we've seen how well this emergency department functions, especially with 1 year ago with the shooting, and how streamlined the process was and everything. Just how proud of you, how proud are you to be a part of this staff, especially what they've seen last year with the shooting and as we've moved the last 6 months through COVID?
I couldn't be more proud of the people that I work with. I think that unfortunately we in Odessa are in a small group of people around the country who have survived a mass shooting, and I think that it made us stronger, and I think that it showed us as a community and showed us as a hospital and as an ER how much we can accomplish when we all work together. And I think that our experiences with that mass shooting just over a year ago really helped prepare us for this current pandemic, because after enduring what we saw last August 31st, there isn't much more out there that scares us. And in preparing for the pandemic, we knew that we could handle it. And every day we come to work, and every day we know that we're taking care of our patients, and we're keeping our patients and our community safe.
You know, we talked a little bit about this at the beginning of the interview. For someone who's still on the fence about coming into the emergency department, say they're having some, they feel some chest pain or maybe some heart issues, but they're still worried about being that high-risk patient, what would you say to someone who's still scared to come to the emergency department, that it is safe to come here? Almost the hospital is almost one of the safest places you can be.
Yeah, as a matter of fact, I would agree with you. The hospital probably right now is one of the safest places that you could be. I feel much safer coming to work every day and seeing all of these patients who do have COVID than I do going to the grocery store, because we have done so much to make sure that we take care of the patients and ensure that we don't spread the disease. So please, if you're having what you think might be a stroke, if you're having what might be a heart attack, please come and let us take a look at you. I can guarantee you that you will not get the COVID. We will keep you safe. We've done everything that we can to make sure that you are in essentially a protected bubble while you are in the hospital with us.
And as far as supplies and PPE, I know that's been a big topic, whether hospitals have enough. Our team has done a great job of collecting and stockpiling those supplies so everybody at the ED feels safe as patients and staff.
Absolutely. We've done a fantastic job. Our materials management people and our supply chain has not let us down. They've scoured websites and they've scoured all of the different national programs that could help ensure that we had enough. And of course, the state of Texas has been very aggressive with that as well, and we couldn't do surgeries right now like we're doing if we didn't have a minimum amount of PPE available. And so we have to have a stockpile in order for us to just continue with everyday operations. So they've done a fantastic job of doing that. I have not felt like I needed to beg or plead for PPE at all.
And is there anything else you'd like to add just about the emergency department in general? Speechless.
You know, I am. I think we've covered all the important stuff. I think that I've been here for 10 years. I'm a transplant from West Texas, and I now call this place home. I now identify as a West Texan. This is a fantastic place to work. It's a fantastic place to raise my family. I feel very fortunate to live here in this community. I feel like we have the best of everything without all of the ills that plague a lot of our more urban areas in the country right now. We don't have earthquakes. We don't have floods. We're doing all right. And I think that we have a top-notch, high-caliber health system here at Medical Center with fantastic doctors who I'm fortunate enough to call my friends, and caring, wonderful nurses who also I tend to call my friends. And I hope that the people of Odessa and the Basin appreciate that. And I hope that they someday, when they need us, they think about coming and seeing us.
That's Dr. Jeff Peno. He's part of our physicians for the emergency department. Hopefully you never have to see him, but if you
Yes.
do, He's
But
here.
if you do, I'm here.
He's
Please
here.
come visit me.
There-
I'll be waiting.
They're willing to help out, and it's a wonderful emergency department. We thank you for joining this month's virtual Food for Thought discussion. Join us next month as we have a new guest.
Take care. Thank you.